and shoulder surgeons at Orthopedic Specialists of Seattle. Today's video testimonial is interesting. 58-year-old female, really active, had an ACL tear and some newer technology. We can actually repair these. And so she was a perfect candidate for it. So we talked about the risks and benefits of this, and she had really high expectations of trying to get back to something in like 3 to 4 months. So the repair kind of fit best with her, understanding all the risks and benefits. So she did it. She was ecstatic. She was able to get back to things that she wanted to do, and she's done quite well. She's super stable, and is now being discharged from the practice, and she's done very well. So enjoy the testimony.
February 17th, I had a skiing accident, and that resulted in a torn ACL, MCL, and meniscus. And when I came to see Dr. Garcia, I was devastated because it ruined my ski season, and I had plans to do some big hikes over the summer, and so I wasn't able to walk. I couldn't move my knee left or right, and I was in a lot of pain. And so when I came in to see Dr. Garcia, I was feeling pretty down and devastated. So we had talked about 2 options for my knee, one being to replace my ACL and one to repair it. And after looking at my x-ray, Dr. Garcia informed me of the different options that I had, and we talked about what my goals were in terms of the quickest recovery possible. And I was fortunate that my injury allowed for the ACL repair, and so that was the option that we decided to move forward with. Yeah, I was fully informed, not only from the information that Dr. Garcia shared with me, but all of the information in the videos on his website. And after I did all of that research, I felt very confident in moving forward with that decision. So I had surgery on March 17th, and my recovery went just fantastic. 2 days after surgery, I was walking, I was putting weight on my leg, I was starting physical therapy, and I started physical therapy twice a week, the week after surgery. And I also highly recommend the high def folks at physical therapy. They were absolutely fantastic. And so I did physical therapy twice a week, and come about a little over 3 months after my surgery, I started training for my hike, which was to do the Aspen to Crested Butte Trail in Colorado. It's about 11 miles. And so by the end of June, a little over 3 months, I was able to hike Rattlesnake Ledge. And then 2 weeks later, I hiked Wallace Falls, which was an 8-mile hike just in preparation for the Crested Butte trip. And I'm happy to say that I successfully achieved my goal of doing the hike, and ever since then have just been on a really great trajectory of recovery. Now that I'm like 7 months in, I've started back doing Orange Theory 2 to 3 times a week, and really don't feel that I'm limited in any way. I'm ready for ski season.
Are you happy to do the surgery?
Oh, I am thrilled that I did the surgery. I feel that it was just the right approach for me, given my physical goals and the things that I love doing in my life. And Dr. Garcia was great about really understanding me and what I needed to do to get my knee back to where I could do the things that I love. And so I would not change anything about the decision.
If someone had a similar injury with their ACL, would you recommend this surgery to them?
Oh, absolutely. Absolutely. The recovery was, it was just surprisingly so easy. I was really happy that we went that route.